Hello everyone. In this video, we will be presenting to you a rare case of photic sneeze reflex and its implication in ophthalmology. 74-year-old male patient presented to our OPD with diminution of vision in left eye since 1 year. He gave history of undergoing right eye cataract surgery elsewhere 5 years back. His visual acuity was PL positive, PR accurate in right eye and 624 in left eye. Slit lamp examination revealed bullous keratopathy in right eye and senile immature cataract in left eye. Something unusual was observed during slit lamp and IDO examination. Patient was all fine until light was shown into his eye. Patient started repeatedly sneezing during slit lamp examination. Patient was dilated for fundus evaluation and similar sneezing episodes were noticed during IDO. On probing the patient regarding the same, patient gave history of repeated sneezing on exposure to bright light. This was something we had never encountered before. We did our literature search on this and came across a phenomena called photic sneeze reflex. Photic sneeze reflex is a phenomena of repeated sneezing episodes following sudden exposure to bright light. It is usually a mild reaction, but sometimes it can impose significant consequences in certain occupations like drivers and pilots. Though some people develop some sort of tingling sensation in nose and sneeze in response to sunlight, pure photic sneezing, which is uncontrollable repeated sneezing episode, is less common. It has also been observed to be triggered following periocular injection. This condition is also called autosomal dominant compelling helioophthalmic outburst syndrome or R2. Photic sneeze reflex often occurs within families and is considered a hereditary condition. Sasayama et al. Conducted a genetic analysis in Japanese population and have identified several single nucleotide polymorphisms associated with photic sneeze reflex or photic sneeze syndrome. Exact mechanism for photic sneeze reflex is not well understood, but various hypotheses have been postulated. First is the optic trigeminal summation hypothesis, which is based on the crosstalk between the second and the fifth nerve at the mesencephalon. An intense light stimulation, either sunlight, slit lamp, or IDO light, activates the optic nerve pathway, which in turn cross-activates the trigeminal nerve pathway at the upper mesencephalic diencephalic junction. This cross-activation results in sensation in the nose, which is innervated by the second division of the trigeminal nerve, resulting in sneezing. In support to this, Hayden et al. In their study reported that hypersensitivity of the trigeminal nerve is involved in photic sneeze reflex. Study stated that light-induced electrical activity in the optic nerve pathway travels directly to the trigeminal nucleus and triggers sneeze reflex. Parasympathetic generalization hypothesis states that on exposure to light excites a specific branch of the parasympathetic nervous system, which in turn activates the other branch, causing nasal secretion and tickling sensation in the nasal mucosa, causing sneeze reflex. Back to a patient, operating on this patient was challenging because of the photic sneeze reflex, as exposing the patient to microscope light would trigger sneezing. Considering him to be one-eyed, we had to be extra cautious. The next dilemma was, what is the ideal choice of anesthesia in such cases? Is it topical, peribulbar, IV sedation, or general anesthesia? Ahan et al. Reported no sneezing when periocular was given with no IV sedation as compared to 5% who experienced sneezing when periocular was combined with IV sedation. Morley et al. Observed that propofol-based IV sedation in combination with periocular local anesthetic injection induced sneezing in one-sixth of the patients. Based on the studies, it was observed that history of photic sneezing, bilateral or upper eyelid infiltration, deep sedation, and concurrent use of midazolam increased the risk of photic sneeze reflex. We went ahead with phacoemulsification and a peribulbar block. After peribulbar block, patient was observed for 5 minutes under the surgical microscope light. He did not have any further sneezing episodes. Phacoemulsification went uneventful with good post-op recovery. Our aim in this video was to draw light into a phenomena called photic sneeze reflex. Photic sneeze reflex, though rare, can have profound effect on the outcome of ophthalmic surgery. In patients with history of PSR, surgery under IV sedation with add-on peribulbar, for example in pediatric surgery, in non-cooperative adult patients, in patients with systemic conditions that require IV sedation, can induce sneezing. In patients with photic sneeze reflex, performing surgery under topical anesthesia can induce sneezing, and it can turn uncomplicated surgery into complication by either rhexis runoff, iris prolapse, or posterior capsular rent. Thank you.